So the study I'm going to describe looked at youth baseball pitchers in Japan, and the authors described something that they call the Yokohama 9, which consisted of 9 stretching exercises and 9 strengthening exercises to be incorporated in baseball pitchers' routines. And they found that patients who incorporated these exercises had a significantly decreased risk of elbow injury. So, Yokohama 9, good to go.
Another article looks at the risk factors of adolescent pitchers for shoulder and elbow injuries, and they found 5 risk factors: age, height, and pitch velocity, but more importantly are modifiable factors that we can influence our adolescent players in, including playing with arm fatigue, as well as playing for multiple teams in the same season. These authors also endorse Major League Baseball and USA Pitch Smart guidelines.
Shoulder dislocations are a common injury, especially among contact or collision athletes. And the question has always been, what is the best way to manage this type of athlete? Is it surgery or is it physical therapy? A recent study showed that if an athlete did have a shoulder dislocation during the season, they did better if they had surgery the following off-season. In the following season, the athletes that had surgery had a 10% chance of another dislocation, whereas those who only had physical therapy had about a 60% chance of another dislocation the following season.
The International Olympic Committee asked a group of sport surgeon experts to systematically study the world's literature, then meet to develop a consensus article. We worked together and ended up with 4 take-home messages. 1. Not all pediatric patients who sustain an ACL injury require surgery. 2. If knee instability is noted, then surgery is indicated. 3. If surgery is required, there are some great surgical options out there. And 4, for young athletes sustaining an ACL injury and needing a graft, autograft, their own tissue, fares better than allograft, which is donor tissue.
Tears to the anterior cruciate ligament, or ACL, are common athletic injuries and often occur when landing from a jump. This study showed that injury prevention programs can improve landing technique, which is important for preventing non-contact tears to the ACL ligament. Available injury prevention programs include balance, plyometric, and neuromuscular, as well as strength and jump landing training. Although important to implement what is available now, the future of these types of programs will tailor to each athlete's specific sport tasks, as well as their individual landing characteristics.
Our study looked at adolescent patients with hip pain, in particular femoral acetabular impingement and labral tears. And what we found was that the majority of these patients, approximately 90%, we could manage non-operatively. And I think the keys to success was that we employed a period of rest, typically 6 weeks, followed by physical therapy, avoidance of deep hip flexion activities, as well as occasional and intermittent steroid injections.
This study was a survey of over 2,000 athletes looking at sport specialization and those risk factors. What they found is that the previous guidelines really hold true, that athletes should not participate in more hours per week of organized activities than their age, with a maximum of 16 hours per week. They should not participate in more than one organized sport at one time, and they should take some time off and not participate in more than 8 months of organized sports.
Recommendations are no advanced imaging for diagnosis, but symptom scales should be used and neuropsych testing may be used. Most mild traumatic brain injury resolves in 4 to 6 weeks. Should be treated initially with restriction of activity, both cognitive and physical, followed by gradual resumption of activity. And if symptoms last longer than 4 to 6 weeks, should be referred to a specialist for treatment.
We looked at 112 adolescent and high school age athletes, and we found that those that lacked sleep, or those that got less than 8 hours of sleep per night, were at higher risk of athletic musculoskeletal injuries. The take-home message is that optimizing sleep may help reduce the risk of injuries in these young athletes.
So this article highlights several important factors. First, pain management after injury or after surgery is very important. We want to adequately control pain and manage patients' expectations. The second thing, though, is we have to keep in mind that in addition to managing pain appropriately, we want to make sure that narcotics are not diverted for inappropriate use or misuse, because that clearly is a risk factor. I think all of us know there's a real opioid epidemic problem sweeping this country, and we want to make sure we manage pain appropriately, but also avoid any diversion or misuse issues.
As physicians, we are committed to educating parents about some of the challenges young athletes face. We hope the featured research findings will serve as a guide to keeping your athletes injury-free and in the game.